friends, I'm pleased to see you all in my channel, Level Up For You. Today I'm back with one more video related to the human body. And this time we are talking about a syndrome or a phenomena named Lazarus syndrome. And in this phenomena, it is said that the patient comes back to life after death. And the Lazarus phenomena or Lazarus syndrome is defined as a delayed return of spontaneous circulation after CPR has ceased. The full form of CPR is cardiopulmonary resuscitation. In other words, patients who are pronounced dead after cardiac arrest experience a return of cardiac activity. And now I will tell you some true incidents. The first one is about an old lady. Her name was Janina Kokiewicz, and her heart had stopped beating and she was no longer breathing. She was declared dead. At 91 years old, she had lived a long life, but she was not about to stop living it. 11 hours later, she awoke in the hospital mortuary with a carving for tea and pancakes. As inconceivable as it sounds, she is just one of the many people said to have risen from the dead. In 2014, a 78-year-old man from Mississippi was declared dead after a hospice nurse found him with no pulse. The next day, he woke up in a body bag at the morgue. These are undoubtedly extraordinary stories that should be in horror movies, but these incidents are really true. To know more information about this disease or phenomena, stay tuned and let's start. The Lazarus syndrome was named Lazarus according to a character in the Bethany in the Bible. The Lazarus was a character who was brought back to life by Jesus Christ after 4 days of his death. And Lazarus, since 1982, when this syndrome was first introduced or described in the medical literature, there were at least 38 cases. And according to 2007 report by Vedamurthy Adhyaman and colleagues, in around 82% of Lazarus syndrome cases to date, ROSC occurred with 10 minutes of CPR being stopped, and around 45% of the patients experienced good neurological recovery. But while the low number of report cases might highlight the rarity of Lazarus syndrome, scientists believe that it is much more common than studies suggest. The Lazarus phenomena is grossly underreported event, notes maxillofacial surgeon Dr. Vibhav Sahni in a 2016 report. The reason for these can be attributed to the fact that medico-legal issues are brought to light in cases which are pronounced dead, which later turn out to be alive. The professional expertise of the resuscitating doctor can be brought into question, not to mention the fact that such an event can lead to disrepute among colleagues. Still now, the reason for the Lazarus syndrome is still now not clear, but there are many theories. Many researchers say that it is due to down to a pressure in the chest due to CPR, and when the CPR is ceased, the pressure gradually releases and again kickstarts the heart to work again. And another theory is delayed action of medication used as a part of resuscitation efforts such as adrenaline. It is possible that drugs injected through a peripheral veins are inadequately delivered centrally due to impaired venous return. And when venous return improves after stopping the dynamic hyperinflation, delivery of drugs could contribute to the return of circulation. Hypokalemia, whereby blood levels of potassium are too high. In another proposed explanation for Lazarus phenomena, as it has been linked to delayed ROSC. Because of few cases of Lazarus syndrome, it is still now not clear that how is it formed, how is it happens, and it is a kind of tricky to find out. And the research is not about that how the patient come back to life, but the real research is that how can they identify it. Because imagine if a patient has Lazarus syndrome and he has died and the doctors have declared them dead and even dug them inside the ground and again he comes back to life, then what a big mistake it will happen. And do you know there is one more story in 2014 in which a 20-year-old woman who had been frozen alive in hospital after being wrongly pronounced dead. In the same year, a New York hospital came under fire after incorrectly declaring a woman as brain dead following a drug overdose. The woman awoke shortly after being taken to operating room for organ harvesting. Cases such as these beg the question, how is it possible even to mistakenly declare a person as dead? There are two types of death, clinical death and biological death. Clinical death is defined as the absence of pulse, heartbeat and breathing, while biological death is defined as the absence of brain activity. Looking at these definitions, you might assume that it would be easy to tell when a person is deceased, but in some cases it is not so simple. There are a number of medical conditions that can make an individual appear dead, and one of it is Lazarus syndrome. And if any treatment will come for Lazarus syndrome, I am quite sure that I will come back with that video in future. With these lines, I would like to end today's video. So if you like today's amazing topic, then give us a like and subscribe our channel, and for proper updates press the bell icon too. And if you can suggest any topic, I would be very glad to make a video on it. So it's all for today. Till then, goodbye.